Hi there and welcome to Life is Movement. My name's Duncan. I am a physiotherapist and owner of the clinic. I largely make these videos for my own patients, for patient education. However, if you are not one of my patients and you find anything in these videos useful, you are of course welcome to take it and use it as you see fit. And I want to use this video to discuss a really fundamental part of physiotherapy, rehab exercises. And that is, what should the exercises feel like? And a lot of people are uncertain whether or not they should be experiencing any discomfort at all when doing their rehab exercises. And people normally fall into one of two camps. They're either very overly cautious and are concerned if they experience any type of discomfort whatsoever when doing rehab. So they're the sort of overly cautious group. And then, of course, you get the other side of the equation, which is the no pain, no gain. These tend to be a lot of gym people or sports people who tend to have the mentality that the more it hurts, the more you feel a burn, the more you feel effort, the better it is. And if you do fall into one of these more extreme camps, there can be some problems that flow from either one. Obviously, if you're in the too cautious group, you either tend to get limited benefit or sometimes not any benefit at all because you're not really pushing hard enough to elicit a physiological response. And if you're in the no pain, no gain group, the too much effort group, you often can injure yourself further. Or if not that, what you can experience is an increase in pain sensitivity. So you tend to make yourself feel worse over time by pushing a little bit too hard. So the advice I give is there is an optimum sort of Goldilocks range of discomfort that one should feel, well, one can and probably should feel when doing any sort of rehab exercises. And that is about a 2 or 3, maybe 4 out of 10 discomfort on the sort of pain scale. So this is what most people would normally describe as tolerable discomfort. So if you're at a 0 or 1 out of 10, that's fine, and you might still be getting some benefit. But if you push a little bit harder, you are likely to get additional benefit, optimal benefit from the exercise. Whereas if you're in the zone where you're at like a 5, 6, 7, 8 out of 10 discomfort, really pushing hard, really pushing into pain, then you're likely pushing a little bit too hard and you need to back off a little bit. So another way of looking at this is I often tell patients you can kiss the edge of discomfort. You sort of touch the uncomfortable range, touch the uncomfortable intensity, and then come off it. And that's generally how we start to improve over time. So like Goldilocks says, not too little, not too much, not too hot, not too cold, just right. Think about that 2 to 3, maybe 4 out of 10 discomfort, tolerable discomfort, something that you could keep up if you had to. But not something that you just, that's so painful that you're desperate to stop the exercise. Kiss the edge of discomfort and you are likely to get the most benefit from your rehab exercises. I hope that helps.